Wagwan people, a very, very beautiful Wednesday morning. Tunapatana tena hapa Treatable, holding it down for this man Willis Raburu. And if it's a Wednesday morning, of course, you know we talk about Mara's health. And today, we want to talk about something that most people don't know about, but it's something that is affecting people so much, especially in this country, Kenya. And of course, niko na daktari hapa. We start with the introductions and we get to it. We're talking about thyroid disease in Kenya. Daktari, how are you?
I'm good. How are you?
I'm great. Habari ya leo?
Mzuri sana. Thank you for having me.
Amazing.
Yes.
You know, when I was going through this, when I was reading about it, I actually told myself, people don't know about this disease.
They don't.
You know?
Yeah.
Because I actually learned about it just recently, too, and it's because someone I know went through it. So let's start by describing what thyroid disease is.
Okay, so let's start off with what is the thyroid. So the thyroid is a gland in your neck, just above the voice box, and it produces hormones T3 and T4, which they basically control your body's metabolism. So if you produce too much hormone, that means you have hyperthyroidism. If you produce too little, you have hypothyroidism. So that's basically the main thing. Yeah.
So how do you know then that this is hyper
or hypo?
Yes.
So first we look at the symptoms. So in hyperthyroidism, you have an excess of those hormone productions. So meaning your metabolism is acting at a higher rate. So most people, they're eating, but they're losing weight, which can be a good thing. They have excessive sweating, they have anxiety, they have tachycardia, meaning their heart rate is raised. And then some people also, they can feel their heart rate, something we call palpitations. That's for hyperthyroidism. Now for hypo, it means you have low hormone levels. So you're more of flat mood, you can be depressed, you're cold, you're more cold intolerance, you're more likely to be constipated, you're always tired, you just feel your body is off. So when a patient goes and talks to their doctor, the doctor should have a high suspicion that maybe this person isn't depressed or they have anxiety. Maybe there's something wrong with their thyroid. All right. So high index of suspect from now the doctor.
True. But some of the symptoms you've mentioned, which I'm sure that there are many more, are symptoms that present themselves in other diseases also.
Exactly.
So how then do you know this is thyroid disease?
So that's where now, let's say I'm the patient, I go to the doctor, I explain to him everything, him or her, how I'm feeling. So there are tests, specific tests, the doctor can say, let's go check out your thyroid hormone. So it's something called TSH, thyroid stimulating hormone, where he checks your level of T3 and T4, which is what the thyroid gland produces. Then from there, they can also do scan. Like some people actually have a goiter. They have an enlargement, abnormal enlargement of their thyroid gland. So they can do an ultrasound and see, hey, there's something happening with your thyroid. Even radioactive iodine scans to see. So there are many tests one can do to see whether you have hyperthyroidism or hypo.
Right. What I'd want to know is, at what stage do you go to hospital, and at what stage do they now suspect it to be thyroid disease?
Okay, so you know, a problem with us Africans, when you feel like you're off, you're like, I just have a kahoma, or I'm sick, or you start saying, maybe I'm just anxious because so many things are happening. So I would really urge people when they feel like their body is off, because you know yourself, just go to hospital, tell them how you feel, be honest, be open, because you know also sometimes when you go to the doctor, you don't disclose everything you're feeling, because maybe you're shy or you don't really want the doctor to know. So from there, that's when the doctor will be able to be like, I know something is not right. Let's just check your thyroid. If everything is okay, we'll check out other things. If not, we'll be able to know.
True.
Yeah.
Okay, so you've gone to hospital, they've checked it. First of all, well, you said explaining yourself is key.
Yes.
But at some point you'd be explaining yourself and, well, they wouldn't understand you better. But before we get to that, so you've gone to hospital.
Yes.
Okay, they've tested you and they've told you this thyroid disease. Maybe it's hyper, it's hypo. And the treatment begins. Yes? So what kind of treatment is involved?
Okay, so let's say you have hyperthyroidism, which is, you're stimulating too many hormones. They'll start you off with medication to stop the production of those hormones. And also because, remember I said that sometimes your heart will be beating fast, you just feel off. So they'll also treat your symptoms with beta blockers and other medications. Then from there, you keep continuing to go. It's not you just get medication and you stop. You have to keep going to your doctor and keep getting your test checked. Because now when your tests start to normalize, then now you'll go into the next phase of treatment. Like you guys will discuss what's next. For someone who now the medicine is not working, there are other alternatives like radiation ablation, but now there's contraindications for that. If you're pregnant, if you're breastfeeding, you can't get that done. And then also with hyperthyroidism, there are people whose eyes bulge out. My eyes actually used to bulge out. That's also a contraindication where you can't do radiation because it will make it worse. Okay. So then for those people, you go now to surgery, where they can remove the whole gland, or depending on whatever they see, a lobe or a section. So it's also patient dependent. It depends on your symptoms, your test results. So that's hyper. So for those with hypo, it means you're not producing enough hormones, meaning they'll give you thyroid medication to take, which most likely last lifelong. But there are those who were hyperthyroidism because of pregnancy, but after their pregnancy, they stabilized. So it's also dependent per patient.
All right.
Yeah.
That you've mentioned pregnancy, I do want to ask, is this a gender disease, or if it affects both people, both parties, or both genders? What gender does it affect more and why?
Okay, so thyroid disease can affect anyone, but mainly it affects women. Because also this disease, like hyperthyroidism, we mainly see it with autoimmunity, which targets mainly women. Okay. So there are men out there who suffer from thyroid disease, but you'll see more of women.
All right.
Yes.
Okay, so what implications does it have, say, on a woman? Say maybe will it cause infertility, things like that?
Yes, those are some of the side effects. So infertility is one, even your menses. Like with hyperthyroidism or hypo, some women see that their menses are longer, they bleed longer, but for hypo it could be shorter. So it affects all aspects. And for men, it can also affect their libido, low libido, or even erectile dysfunction. So,
all right.
Yeah.
You see, then if it would affect, say, maybe your menstrual flow, mostly it happens, and people would not think this is thyroid disease.
Yeah.
You know?
Yeah.
Then what is the clearest of indications to say to a lady that, you know, this is not normal? Like, say, you could say it's hormonal imbalance, where, say, maybe today, this month, I skipped, this month, it was prolonged, it was short. What is the clearest indication in all this that this is thyroid disease? Because I don't think it will be at the back of your mind that, you know, because you say thyroid disease is somewhere here.
Yes.
Yes?
Yes.
So it's not natural for you to think that this could be affecting my flow, you know?
Yeah.
So what could be the clearest of indications that, you know, this is thyroid disease?
Like I said previously, all the other symptoms, because the thyroid, it affects everything from your head to your, exactly.
Okay.
Because it affects everything starting from your head, your heart. You can even get tremors all the way to your toes. So it's you to know your body and to see, I know, I used to be like this, now I'm changing, something's not right. Oh. So a person has to, anajijua, they know themselves, and they need to be able to be like, no, something is off, I need to go get checked. Okay. Yeah.
Is it a condition that you would say is, I don't want to call it fatal, but is it life-threatening?
Yes, so actually this year alone, we've actually lost 6 patients of thyroid because of misdiagnosis or being mistreated. Okay. And 2 of those were cancer patients. And actually our youngest, she was diagnosed at the age of 7, and she lost the battle when she was 11, so she fought. So now you see, it's also, like I said, if you keep delaying, you could be getting worse, because there are some people, I said, remember, you could have an enlargement. And then for some people, they can see it's actually starting to enlarge at a fast rate, but they're just like, normal too. It's not normal. You need to go get checked.
All right.
Yeah.
You've mentioned a 7-year-old. My next question would have been the age. At what age do you expect to have this, or is it just any age?
So it's rare to get it at birth, but it happens, like, for instance, in hypothyroidism. But typically, you typically start seeing it in 20s going above. Yeah, that's when now symptoms can start occurring.
In both genders?
In both genders, yes.
Okay.
But sana it's more predominant in women.
You've said sometimes there could be a misdiagnosis of it, yes?
Yes.
What would majorly lead to a misdiagnosis?
So let's say someone comes in, they go to the doctor, and they're like, "Hey, daktari, nasikia roho yangu ikipiga-piga." See, the first thing a doctor would think, there's something wrong with the heart. You won't really necessarily think it's the thyroid. So you see, some of these symptoms, they can be anything from the heart to depression. Because if I go and I'm like, doc, sometimes I can't even get out of bed. I just feel tired. I don't know what's happening with me. I'm just agitated, irritable. The doc will think, maybe this person is suffering from some sort of depression. Not thinking that it's actually the thyroid hormones. Yeah.
All right, because I have a friend that gave me a similar story. They would go home feeling very tired, and they wouldn't understand, because even if they didn't go to work or they didn't do anything, they just wake up tired.
Yeah.
And then they're wondering, what's happening with me? They go to hospital. Sometimes they'd give him muscle relaxers, until they came to realize, actually, this is something different.
Yeah, because we even have someone in our support group. He's a teenager. He's a boy.
Okay.
So in school, he used to sleep. Like, you know how, okay, maybe mutu akikula ugali, you get sleepy, but him, it's like throughout. He's just tired, he's sleepy. But now the teacher is thinking he's taking drugs, because they're not thinking like it's something. So he's even subjected to do drug tests. It comes back normal. So they're like, I know, like the mom and him, they're like, no, there's something wrong. That's when they now fiercely went to the doctor and now sought advice, like, what's happening, because my child is not on drugs, but this is how he's feeling. That's when now they're able to figure out his thyroid was acting up. So it happens a lot.
True.
Yeah.
At least that's lucky, because most of the teachers would call it laziness. I'm like, you're just being lazy.
Yeah.
Get up and work.
Yeah.
Yet you're suffering.
Exactly.
Allow me to digress a bit.
Okay.
Because you mentioned it has to do with the neck, and I also know that the adenotonsillectomy surgery happens around that area, especially for children. You know, could it be confused?
Yes, because actually sometimes people are sent to the ENT and not an endocrinologist. So they think, because it's in the neck, let the ENT come and figure out what's happening. So that happens a lot also. Yeah.
All right. Okay, so now let's talk about Kenya.
Okay.
And this disease,
because
it's fairly new to us even.
Yes.
You know, so I am sure that the majority of the population out here don't know about it.
True.
All right. So first of all, is it easily treatable in Kenya? Let's start with that.
I would say once the doctor figures out whether you have hyperthyroidism or hypo, it is easily treatable. But now the issue is thyroid disease is very expensive, because remember I said it's an autoimmune. So if you have insurance and you disclose that, they'll be like, no, because you're already at risk.
Oh, so it's not covered?
Most it's not. So that's why as the foundation, we're even talking to different insurers to now come up with a plan for thyroid patients. But if you go to the doctor and he figures out what's wrong, they'll start you on treatment, and there's hope. It's not like you'll die. But now if you wait too long, maybe like I had said, you see your thyroid continues to grow. They need to check whether it's benign, non-cancerous, or malignant. So those are some things people need to think about.
Okay.
Because I actually had a friend who had a lump in his neck, but he was scared to go to hospital because he doesn't want to hear what the doctor said. I'm like, no, it's rather you know and get it sorted out earlier on than wait until it's too late and
nothing can be done.
So I think also a lot of people are scared
That's
to
true.
go to the doctor and find out
All right.
you're sick.
Actually, I do want to talk about the stigma
Yes.
and trauma around it.
Yes.
You know, because first of all, the male species,
Yeah.
it's not easy for us to go to hospital.
True.
You know, we assume everything, like, you know, itapita,
Exactly.
kidogo,
Yeah.
it'll go away. And other people will be like, hey, what if I go and they tell me it's cancer?
Yeah.
What happens to me?
Yeah.
I am not, maybe I'm not financially in a good place to handle this thing. So someone would want to ignore it.
Yeah.
You know, like, itaisha too, let me take painkillers.
Exactly.
In such a situation, how would you advise someone to go about?
I would advise that it's better ujijue. Like for me, I always say it's better you find out early on so that they can intervene earlier on than wait. Because even as you wait, you also feel yourself, you're not okay. But maybe you start thinking, no, I have stress from home, finances, that's what's bringing all this. But really, you actually have an underlying condition. So it's better to just know and have support. You know, like when you have family, friends who are there for you, it's easier. Yeah.
Will this affect a pregnancy? Say, if it was diagnosed in the middle of a pregnancy, will it affect a pregnancy?
Yes, it would affect pregnancy because, you know, in pregnancy, you can't take some medications.
Okay.
And then that's why even with people who are diagnosed with hyper or hypothyroidism, their gynecologists have to be hand in hand with the endocrinologist so that they'll be able to carry the pregnancy to term. And we even have women who have thyroid disease, but they've been able to carry their pregnancy to term. But then we also have those who have miscarried and they have infertility issues. So it's always important to be hand in hand with your gynecologist and endocrinologist so they can work together for your best treatment and best outcome.
All right.
Yeah.
So let us talk about the foundation now, the
Okay.
Thyroid Disease Awareness Kenya Foundation.
Yes.
I saw you had an event on the 24th
Yes.
of September. Tell us about the foundation first.
So the foundation was founded by our CEO and founder, Sarah Katuli, in 2017.
Yes.
So it's registered as a non-profit foundation. And she actually created this because herself, she's gone through this during her pregnancy. And she felt like she was alone and there was no one else. So she's very passionate. And she wants to bring awareness not only to doctors, but to patients. Because, you know, when you go to hospital, many patients don't ask questions. Like if a doc says, nitakuandikia hizi madawa, enda ukunywe, and then urudi, they'll be like, okay. But they don't ask, why am I taking this medicine? Why are you giving me this medicine? What's it for? So she's very passionate about patient education. You need to know what's happening with yourself, your body, so that also you can know what's happening and how to get better. So she founded this, and on the 24th we had an event. So many thyroid champs, not just champions, but even caregivers came, because it doesn't just affect the person suffering, it also affects the family, the caregiver. And we had doctors come and also talk. Even the CEO of NHF was there, and even other insurers, to hear the stories that patients go through. Because there's this lady who had an issue, and she had NHF and it was active. So she went to seek treatment, but she was denied because they were like, you're a civil servant. So you see, like, it's not just getting the right diagnosis, it's also the finances. So that's why we're coming together to see how we can bring change and awareness, not just to patients, but to doctors and even NHF and other insurances.
All right. Considering that this is a disease that you've said is affecting a lot of ladies, and it is rarely spoken about, do you think the policymakers in this country have given it the priority it deserves?
I don't think so. Because even in med school, when we are taught about endocrinology, the major part of what we're taught is diabetes. These are the ones, like, you'll have a talk for an hour and then it's forgotten. Not like really realizing that so many people are actually suffering. So that's why the foundation is there, because we want to go to policymakers to try and make change, positive change, and bring awareness. Because many people are suffering and being misdiagnosed.
Okay. Most of them could be watching right now. Yeah, it's your time it's called to make your case.
Yes.
To state your case now, because from what you're saying, this does not look like something that is easily treatable.
Yes.
It really requires a lot of finances.
Yes.
And if you've mentioned also some insurers are skeptical about insuring the disease, then it means it's a very uphill task to treat this.
Yes.
So how would you want them to proceed now?
So we're actually working with one insurance company, but now the thing is they need numbers. So that's why we're working with the foundation and that specific insurance company, so that we can show them, you see, all these people are actually suffering. But now, because imagine like going to hospital, like let's say you have to go get your thyroid hormones checked and other levels. It can even be like anywhere from 10,000 Kenyan shillings to 20. Now imagine having to go like every 3 months or 6 months, and you haven't even put in the consultation for the doctor. It gets to be pricey. So that's where we're like, we need a package, because they can also see it's not like because I have thyroid disease, I'm dying tomorrow. There are people who have in the group who were diagnosed in the 90s. They're still alive and well.
Right.
So, and it's not fair to discriminate. It's not like I said, let me be born with thyroid. It's what
It's a disease.
It's a disease.
Yes.
So they also need to be treated fairly and also with dignity, because it's not just saying because you have thyroid, there's no hope. There's hope, because I also suffered.
All right. Okay, then now that you've mentioned you also suffered, please tell me your journey and how you realized that this is thyroid disease and the treatment.
Okay, so my story is a bit different, because my diagnosis was made late 2011, early 2012,
Okay.
but I was in the States.
All right.
So I got sick and I went to the hospital. So my doctor actually noticed my eyes were bulging out. I just thought I used to have big eyes, but he was keen. And then he realized my thyroid, I had a goiter.
Okay.
And then when he started listening to me and my history, I used to tell him I used to sweat a lot, I used to get anxious, I used to get tremors. But now me, because I was in school, I used to think, I'm stressed because of exams. So I used to like find excuses of my symptoms. But he was like, no, there's something happening. That's now when they did the thyroid test antibodies and saw that I had Graves' disease, which now is a part of hyperthyroidism. So my body was creating too much thyroid hormones. But now we were relocating, so I came to Kenya. And then that's where now I had to find like a good doctor, which was a struggle, because the doctors I went and saw, I was mistreated. I'm the type of person who I'll always ask questions.
Okay.
So I'd ask questions, but I'm asking, but they're not answering. And then it's like heavy. So me and my mom, we weren't comfortable. So I actually had to go to India, where I had surgery. I had a subtotal thyroidectomy.
Okay.
And what I would hope in Kenya, because when I went to India, they start from the beginning. They do all the tests afresh. They explain to you the disease, because maybe you've never heard of it. So they explain this is what's happening to your body. They give you all the options of treatment, and they tell you, my recommendation, this is the best treatment. And even with the treatment, they tell you these are the complications that can occur. And afterwards, most likely, there's a possibility, because you're hyper, you'll go into hypo. So they really sit down, explain to you until you're comfortable, and then you have to sign. So that's my hope when now it comes to Kenya, that doctors are able to sit down with their patients, take the time and listen. Like listen, let the patients ask questions. Don't be like in a rush or get mad, because you also need that doctor-patient relationship, so that even the patient feels comfortable to tell you, doc, hey, I'm bad. This is what I'm going through. So I think that's also key.
True.
Yeah.
And during this time, were you still practicing medicine?
I was actually now getting into med school. So now after I came back from India, I actually got depressed, because now see, I was overproducing hormones. Now I'm hypo.
Okay.
So now, even now, like trying to get my levels to balance. And then also with the struggle of med school, you know, it's not easy.
It's not easy.
It's not easy. So
Yes.
I actually got depressed a lot. Actually, no one knew apart from my mom. Because after class, I would come home and cry. So I remember one day my mom told me, like in 2012, she was like, Aya, these are the cards you've been dealt with. You have to accept, because that's also a process of getting better. You have to accept this is what you have, but it's not the end of the world. And who knows, maybe you were given this because one day you'll be able to help someone because you will know how it feels. Even though I'm practicing med, I'm also a patient.
Okay.
So I know how it feels like to be a patient and to feel like there's no hope, like I might die. So she was like, so it's coming to pass. So even if I'm getting to help one person, that's something.
That's true.
Yeah.
And today you are helping millions.
Yeah.
So you actually, this is interesting because, you know, mostly when we talk, we tell people, you know, even in a situation where, say, it's grief, there's stages of grief.
Yeah.
You know, stages of recovery, you know, even if it's an addiction, stages. But you've gone through all those stages.
Yeah.
So you're better placed to explain those stages, say, of healing.
Yes.
From diagnosis to healing. What does the procedure look like? How long does it take from diagnosis to treatment to healing?
So for everyone, it's different. So I think the key thing is, like, when you find out you have this disease or even any other disease, you have to know, you have to come to terms with it. Because if you don't come to terms with it, there's really, like, no hope, because sometimes you'll give up, you'll be like, what's the point? So I feel like patients who have been diagnosed with thyroid disease and any other disease come to terms with what you've been dealt with and know that it's not the end of the world. If you take care of yourself, if you go to the doctor, do what you're supposed to do, there's hope and you'll get better and you'll feel better. Not saying you'll be better like throughout, because I have days also where I don't want to get out of bed and I just have low moods, but that's life.
Okay.
And you have to take it one day at a time and have a support group. I think that's key. Because, you know, some people, they shy off from telling people their experiences because they feel you'll be stigmatized. They'll be like, who you to anajiekelea. But it's your body telling you, like, you're not okay. So I feel like there's that also stigma with thyroid disease and any other disease. Sometimes people close off because they feel like no one else will understand. But there's so many champions out there, because in our group, we have a WhatsApp group. Sometimes you guys are like, I had gone to my bedroom but now I don't remember what I was coming to do. Or like, guys, I'm struggling, like I can't even get out of bed. So we just try to be there for them, support, because we know what it's like. So when you ask me like the duration, you can't really say, because everyone is different and they go through healing differently.
All right.
But I think it's key that you have to come to terms with what it is. Make sure you realize what the disease is, like your treatment plan. Be open with your doctor. When you're not feeling good, call your doctor. Because even me, like last month, I knew my levels were off because of how I was feeling. So I called up my doc. I was like, hey, doc, I'm not doing okay. I need to make an appointment. So you see, if someone like ignores all those signs, you'll actually get worse, because maybe they need to titrate your medication up the dose or increase. So as a patient, you also need to listen to your body.
True that.
Yeah.
It's a journey then.
Yeah.
It's a journey. So we have feedback from home.
Okay.
People ask questions.
Okay.
And since we are lucky enough to have you here, you will answer some of them.
Yeah, that's fine.
Ibra, can we check 2 questions? Tatu, mbili? All right. Okay. So Njeri from Komaji says, how accurate are thyroid tests? Will I need more tests done? Okay. That's Njeri.
Okay.
Andove from Komarok. Love the show. I have a friend. Thank you, Andove. I have a friend with the same disease. Does he need to take precautions while doing activities? All right. Alexa from Kipkaren. How will I know if the medication given is working? Does it take days, weeks, or months? I think let's answer those 3 first. Then we go back to the rest. Sindio? So the first question was from Jerry. Yes. Jerry was asking how accurate the tests are.
So the tests are accurate, but you have to go to an accredible lab. So the doctor will tell you, these are the tests we need to do, and that's now where he'll see where your levels are, and that's how he or she will determine how now you'll the medication, whether you need medication, radiation, or surgery. So the tests are accurate. Yeah.
Is there an importance of seeking a second opinion?
Yes, like now you saw for me, like I actually saw 3 doctors in Kenya, but my feedback wasn't good, and I wasn't feeling like it was okay. That's why now I went to India. So it's important, if you feel like your doctor isn't getting you, or you feel like they're not explaining, please do get a second and third opinion, because at the end of the day, it is your body.
True that.
Yeah.
So with these doctors in Kenya, what about the doctor in America, in the US? What did they diagnose?
It was right on hyperthyroidism, Graves' disease.
So when you came to Kenya, they said it was something different?
No, when I came to Kenya, they mishandled me, so with my medication. So my levels they were high. So instead of increasing my dose of medication, they decreased. So I'd ask questions, but they wouldn't really be answering. So even by the time I went to India, my levels were so bad. So I actually had to wait before I went into surgery.
All right.
Yeah.
The second one, they were saying they have a friend that has the same disease. So do they need to take precautions while doing some activities?
Like I said, if they're on medication, like let's say his friend has hyperthyroidism, so sana he'll feel like maybe his heart is beating. That's when now the doctor will come and give him medications to help with those symptoms that he's experiencing. But he also, like maybe he's a football player or he does swimming or whichever activities, they also have to be mindful of their body. Like if they're feeling like they're too tired or fatigued, take a break, it's okay. And then maybe go back to your doctor and be like, hey doc, these meds that you're giving me, I don't think they're working. So they have to listen to their body and work hand in hand with their doctor.
Okay.
Yeah.
Before we go to the third question, so among the symptoms, is there like fainting? Could that be a symptom as well?
It could, but with hypothyroidism, they'll just be lethargic, they'll just feel tired, they don't want to get out of bed. Like, so someone can even be mistaken that they're depressed, but it's actually like you have low energy levels.
All right.
Yeah.
All right. So the third one, Alex from Kipkaren had asked, how do I know this medication is working? How long should I wait to feel a change in my body? Does it take days, weeks, or months?
So first off is also how you're taking the medication. Because even for me, I had doctors who didn't really explain to me how I need to take the medication for it to work effectively. So if, for instance, let me give you an example. If you have hypothyroidism, you'll be given thyroid medication to help with your hormones. But now that medication you need to take in the morning before you eat so that it can be better absorbed in your body. So you give it, depending if now you were just diagnosed, you have to give it some time for it to work. And that's why you go back to the doctor, you repeat now the test. See, they have the initial test that you did. Now this test that you see, he'll be like, you're doing well, let's maintain with this dosage. Or maybe if he sees that your levels aren't changing or they're getting worse, that's where now he'll be like, I know, let's pump up the medication. And so it's really dependent on you taking the medication, because you know also patients don't like taking madawa. Sometimes they'll miss, and that's not helping. So if you have a tendency of not having your due diligence of taking your medicine every day, you're not helping yourself because your hormones will be fluctuating. Okay. So as a patient, you need to take your meds every day, and not just after your meds are gone, you don't go back to the doctor, you'll be like, nimepona. No, because this is a lifelong journey. Okay. So you have to keep going back and getting tests done to see if your neighbors are stabilizing or if they're getting worse.
Okay.
Yeah.
There's something you've mentioned. Is that a thing that if you took medicine before you eat, it would be better absorbed in the body?
Yeah, it's a thing.
It's a thing?
Yeah.
Allah. I've always thought it's just a story out
But
there.
it's dependent on the meds.
On the meds as well.
Yeah. So I just gave an example with hypo. It's better to take it when you wake up without eating.
Okay.
Yeah.
But would you give a time frame for when to see changes? Because then how do you know that whatever you're being given is not working or it's working?
So now when you go to the doctor, that's why it said it's patient dependent, because you know someone, their levels could be really bad.
Yes.
So they've started on the treatment. The doctor will tell you, okay, let's give it like 3-4 weeks, come back and see me. We do a repeat test.
Okay.
Versus like maybe now me, because I've been on medication for like 10 years, unless now I'm feeling off, I'll go to my doctor like after every 3 months or 6 months. So it's patient dependent.
Okay.
Yeah.
So it is the test that will tell you of the progress.
Yes.
It's nothing physical that you will feel.
No, it's also physical.
You also feel the physical.
Yeah, because you'll feel changes. Because now me, when I was first diagnosed, see, I used to feel like my heart beating.
Okay.
But now they gave me medications, it got better.
Okay.
Yeah, so it's not just test, it's also how you feel in your body.
But I'd imagine such symptoms would bring, say, panic attacks.
Yes.
Because if you had your heart was beating, most chances are that you would have a panic attack.
Yes.
You know?
Yeah.
A condition that comes out of a symptom. So how would you better explain to someone that whenever it starts happening, not to have that panic attack?
Well, okay, for me, because before now my surgery and everything, I would get anxiety. But now that was also because my body was just overproducing.
Yes.
So the medicine helps, but then it's not just medication. You need to find ways, like the doctor can help you, whether find ways of how to relax yourself, relax your body, so that you don't go into a full, but it happens. Even people in the group now, some suffer from anxiety, panic attack, because you also start overthinking.
All right.
Yeah.
Okay. Let us take more feedback. Ibra. Yeah. We've answered Alex from Karen, yes? Yeah, Karen from Mombasa. What happens when I miss medication? All right. Makena from Busia. What diet should one use having such disease? Very good question, Makena. Achieng from Kisumu. What might be the accurate price of treating such a disease? Is it expensive for a local mwananchi? Are there also herbal means of treating it? Okay, tujibu hizo tatu kwanza. I feel like we should start with Achieng from Kisumu. Okay, yeah, Achieng tutaifanya ya mwisho because tutakurudi kwa foundation na kwa serikali na policy makers. Yes. Let's start. Karen alikuwa Mombasa? Yes, Karen from Mombasa. Okay. So, Karen ameuliza nini? I had already gone to Kisumu because I know this one will be a big one.
Okay.
You have a lot to say. Karen was asking, what if I miss medication?
So like I said, if you miss your medication, you're not doing your body any good, because you're actually going backwards. That's why I said with thyroid disease and any other disease, if you're on medication, please, please, please take your medication every day. Because if you miss out, like let's say, nitakunywa kesho. Kesho comes, you forget, I'll just take it the next day. Now you see either your hormones will start going up or down. So you're not doing yourself any good, and you can even worsen your symptoms.
True.
Yeah.
Then do you run a risk of your body growing resistant to the drugs if you keep missing the drugs? You know, say when you underdose yourself, say maybe it's an antibiotic, and your body now, whenever you take the antibiotic, it does not work for you. Is there a risk of that? Okay,
not with thyroid, because these are medicine you'll be taking, most will be taking lifelong. So you can't compare it to like antibiotics.
Okay.
Because you know, even as Kenyans, like when you get sick, antibiotic, that's now where you grow resistance.
Okay.
But this, because it's a drug that's either suppressing your hormones if you have too much, or it's helping you get the hormones that you're not producing. So you see, it's actually something you need, so you won't get resistance. Yeah. Okay,
the one from Busia had asked the kind of diet you should be on. Is there a specific diet you should be on?
As well as your diet is well-rounded. So even because another cause of thyroid disease is iodine deficiency. So you know, you get that from your meats, your mboga, but at least now it's in the salt. So as long as you have make sure you eat your greens, your vegetables, your protein, whether it's fish, meat, seafood, and then your carbohydrates. You need to have a well-balanced diet. And remember water. Most guys don't like drinking water.
That's true.
Yeah. Yeah.
So are there things to avoid then?
Well, cigarette smoking. Because that worsens. It can worsen. Especially if your eyes are protruding out.
Yes.
With cigarette smoking, it can make it worse.
True.
Yeah.
All right. So, but before even we go to the Kisumu question, I'd want to ask, you know, does it mean every swelling that happens around your neck is to be associated with thyroid disease?
Not necessarily, because, you know, some people, they could actually just have a big neck. But it's always good to go and get checked, especially if you feel, because you can even have nodules. Okay. So especially if you feel and you feel like, I know. You know how when you do for females or males, when you do a breast examination, if you feel like you have lumps. Okay. So for thyroid, there's some who actually have those two nodules and lumps. So it's just important. If you think that your thyroid or you see that your neck it's getting big, just go get checked out, because it won't hurt to get checked out. Okay. And give you a peace of mind. All right. That's true. Talking of peace of mind, I'm sure the question from Kisumu will take us to the government, to the foundation, and to us as well, okay? Yeah. So they have asked, what would you estimate to be the treatment for this disease? And is it affordable to a common mwananchi? Say a common mwananchi is a mwananchi that operates under $1 per day. Yeah. You know? Yeah. So is it treatable by a common mwananchi? And what would you estimate is the treatment expenditure? So now, depending now on your treatment, if it's medicine, because there are even people in the group who struggle to actually get the funds for the medication, because during this time, certain companies have actually increased how much medicine is. And that's also another thing we're working with the foundation to talk to them and be like, you're not being practical, because this is a patient you'll be having for life, for a lifetime. Why are you increasing the medication? It's not fair. So that is actually, we're in the talking stages. So people there, they are aware. But now let's say if you want to get radiation, I know that is available at KNH and Aga Khan, but actually that is covered under insurance, and that can cost, I might be off, but from like 120 to 200,000. So it also is dependent on your insurance. Then also now for thyroidectomy, it can get costly. Okay. But that's why we're working with certain insurers so that it can be not easily affordable, or that the common mwananchi can be able to seek the help they need. All right. Yeah. So, is what have you called the surgery that? Thyroidectomy. Okay. Thyroidectomy. Yeah. Is it available in Kenya? Yes, it's available in Kenya. Even say in KNH? Yes, because they're thyroid surgeons. And there are actually 20 endocrinologists in Kenya, but 19 of them are in Kenya. One is in Eldoret. All right. So that's another thing we're working on with Daktari Online, is to train doctors that are huko mshanani, that they'll be able to help thyroid patients. Okay. So that's in the works. Because you see, all of them are in Nairobi. Yes. And we have patients in Kisumu, Kericho, Machakos, Mombasa. So some of them actually travel here, or they do teleconsults with their doctor. Because I'd imagine you say someone is down there in Samburu or somewhere. Exactly. In Makueni, and you're saying the doctors are in Nairobi here, others are in, say, Lamu. Exactly. They need the treatment. Yeah. So I'm sure it's something you're engaging the government also to make sure that these services are available countrywide, you know? Yes. Because also not all of them can travel. Exactly. To Nairobi, you know? Exactly. Or make that call and get treated and told what is this. Because, you know, we cannot also assume the literacy levels of this country are up there. Yeah, you know? That's true. All right. So you've answered that one correctly. I'm sure with the foundation you are doing something about it. Yeah. Okay, tumalizie tuchukue hizo zingine. All right. We had answered Makena from Busia, alikuwa ameuliza about diet, ameambiwa ukule tu vizuri, Achieng wa Kisumu. There was another bit kwa swali ya Achieng. Achieng had asked if
there is herbal means of treating it?
So yes, so for that one, they would now have to go to those certain doctors. I don't really want to say, because you know whatever you say can also be misconstrued. So
That's true.
they have to, because it has worked for some it doesn't. That's why it said it's patient tailored. So
Okay.
some actually do take herbal medications, concoctions, and it works for them, and they're doing well.
Okay.
Some tried and it doesn't work. So that's where you actually need to sit with your doctor and talk and see.
Ah.
Yeah.
All right, Achieng from Kisumu. I hope you've been answered. Jane, my hair is falling out, please. Help, Daktari. What should I do? Right? And Val from Nandi. Is there a possibility my thyroid disease will require surgery? All right. Enjoying the show. My mom had the disease. I don't have it. Will my kids have the disease? Okay. Okay. Let's start with this one. Is it a genetical thing? Is it passed from generation to generation?
So there, like I said, it's autoimmune. So sometimes you do see it within family. So she said that her mom had it.
Yes.
She doesn't have it, so she's wondering if her child has it.
Yes.
So what I can say to her is that she needs to now start looking at her child and start seeing if the child is changing. Now I don't know how old the child is. So if it's a young child, if they see they're not thriving, they're not reaching their milestones, they can just go and get their levels checked. But let's say it's someone who's like maybe in primary and they see, I know there's something off. They can always go and get their child tested to see whether they have the condition.
Okay.
So they have to observe their child and know their child and also listen.
Okay.
Yeah.
That's all right. I hope umesikia. The other one said, I think it was Jen, that her hair is falling.
Yes.
And what does she need to do?
So she most likely has hypothyroidism because you start getting coarse hair, your hair starts falling out.
Okay.
So she needs to tell her doctors, but there are supplements she can take to help with that. Yeah.
So it is a situation that can be salvaged.
Yes.
You know, but also in most cases where hair is mentioned to be falling off, it is mostly associated with cancer.
Yeah.
You know?
Yeah.
So is there a reason for her to worry on that also?
No, it's one of the symptoms of hypothyroidism. We see that people's hair, it becomes brittle, like so inachana tu. Ukichana unaona nywele yako inakatika.
Okay.
So it's actually one of the symptoms.
All right. So is there a reason, say maybe to also get a cancer test?
So now when she goes to the doctors and they see whether if she has hypo, or the thyroid, there's a test that's done, fine needle aspiration. That's now a test that's able to tell you whether it's benign or cancerous.
Okay.
Because even me, when I went, you have to be tested when they took the thyroid and it was benign.
Okay.
Yeah.
All right. So the last one was about if she asked if her condition would require a surgery, you know? If I were to expound on it, because she does it like that, what we see mostly with, well, I won't call them doctors because a normal doctor shouldn't do that. I would call them quacks. Say, it's people that want easy money, you know, that I would come to you, this condition hasn't gotten to this point, and you say this is what we're supposed to go for surgery, you know. So what is it that now precipitates a surgery? You know, like at what level do you say from here it is surgery? It's not medication, it's not radiation, it's a surgery.
So surgery is usually the last option.
Yes.
So, like, let's say you've been on medication for a long time, but the doctor is seeing the medication is not helping. So if you're a candidate for radiation ablation, that's now another option you'll do. But remember, I said it's not for everyone. If you're breastfeeding, if you're pregnant, or if you want to get pregnant, or if you have that condition, thyroid eye disease, where your eyes are protruding, you're not a candidate. So that's where you go straight into surgery. So surgery is not for everyone, but it's also dependent on you and your levels and how you're progressing.
True.
Yeah.
Okay. I hope you've heard. Na umesaidika, si ndio? Now this one is beyond the patient now.
Okay.
Now this one is to the caregiver.
Yes.
As we wind up.
Yes.
You know, because as you've said, I won't call it a relapse, but you've said that the symptoms do not disappear immediately. You know, so a caregiver is human.
Yes.
And mostly they tire.
Yeah.
It's like, wewe unashindanga umelala, unasema uko lazy, you're depressed.
Yeah.
You know, so it also takes a toll on the caregiver.
True.
You know, so in such a situation, how do you advise that caregiver?
So this is something we see a lot, especially if they're married, because it puts a strain on the relationship, or like you and your parents.
Okay.
So whenever you go to the doctor, it's important you go with the person who's taking care of you or who you're with, so that the doctor can also explain, by the way, this is some things you'll most likely be seeing, so that even the caregiver is able to understand what's happening, and it's not like you're lazy. So both of them need to understand, the patient and the caregiver. And then they also just work hand in hand. You have to understand that some days the patient, they won't have good days. They'll have some bad days. But just do your best to be there for them, encourage them, uplift them, make sure they're doing what the doctor said they're supposed to do. Because, you know, sometimes it reaches a level where you're like, mi nimechoka, like, sahi kunywa madawa, what's the point? So just be there to encourage and support them, because it's not easy.
True.
Yeah.
Is there like a support group for the caregivers?
Yes. So in TDAC, so we have doctors, patients, and caregivers. So we all support each other, and they can even reach out on Facebook, Twitter, Instagram, and then that's now when we can add them to the group.
Okay.
We're one big family. We help each other out.
Amazing.
Yeah.
So you say they reach out on social media.
Yes.
Where do they reach out? Like, what are the handles?
So Thyroid Disease Awareness Kenya Foundation on Facebook. They can just search that. It will be on Facebook, Instagram, and Twitter.
All right.
Yeah.
All right. I think that's a perfect place to end it. You've demystified a lot of the questions we had.
Yeah.
And I'm sure people at home have also got a chance to maybe get answered questions that have been stressing them. I can imagine, like, for the one that the mom had and now she's wondering if the kid has it.
Yeah.
Must be a traumatizing experience, you know?
Yeah.
But at least you've shed light on that.
But if I can just say one more thing,
Yes.
like, because I know people are always scared to go to hospital.
Yes.
So what I tell the person watching this is go to hospital if you feel your body is not okay, if you feel like there's something off. You'd rather just go, get checked out, and be safe than sorry. And it's not the end of the world if they say you have thyroid disease. I've been living with it for 11 years, and I'm doing okay. So there's hope. You have to take it one day at a time. Make sure you have a good support system. If you have no one, welcome to the TDAC family. We're happy to take you in and walk with you through this process.
Amazing.
Yeah.
Please talk to people that self-diagnose, that we feel this and we just go to a chemist or any particular fulani.
Yeah.
And please address such people, because that is a very big thing in Kenya, you know.
Yeah, and that's why I said, like, listen to your body. It's not always that it's a common cold or something. Sometimes it could be like your hormones are just not there, not working. So you'd rather go get checked than be sorry, basically. That's the bottom line. Because even if you feel like, you just keep going to the chemist, you're not getting better, a light bulb should start clicking, like, I know, I need now to go see a doctor and see what's up. Yeah.
Let me ask this as we wind up, because if I don't ask it, I will not be fair to the organization, to TDAC, because you had an event on the 24th.
Yes.
You must have come up with policy that you think you should need to engage the government on.
Yes.
You know, like making this available, creating awareness around the disease. What is the major point that you'd want to engage the government on this thyroid disease?
Insurance sana sana, because this is a disease that is not pocket friendly.
Okay.
From the medicine to the test to the consultation. And that's why we're working with NHF and another insurer, so that we can have a package for thyroid patients so that they can be covered and get help with their medication and test. So it's ongoing, so I can't say much because we're still in the talking stages, but we're hopeful
Oh.
for change. Because now at least you guys are bringing awareness. Now majority of people are aware there's something called the thyroid.
Yes.
So as long as there are awareness, the numbers will come, and you know numbers talk. So when we get those numbers, we'll be able to sit down and now say this is what we need.
Okay.
Yeah.
Thank you very much, Daktari. Where do we get you on your... Are you on Facebook, Instagram, Twitter? Say if someone has watched you today and they want to continue this conversation, can they DM you?
Yeah, they can shoot me a DM, and then I'll also link them in with the foundation. Okay. So on IG, it's at IWENNIE. It's a nickname, or they can search for my name, Irene Duta Kangara, and also on Facebook.
All right.
Yeah.
Thank you very much, Daktari.
Thank you for having me, and thank you for this platform to bring awareness. It's important.
Amazing.
That's the first step
Ndio
to change.
Ndio.
Yeah.
A journey of 1,000 miles.
Yeah.
It has begun.
Yes.
Ndio. Amazing. I hope wale mko nyumbani mwende mfollow Dr. Irene Duta. Hapo uulize maswali zako zile tujaweza kujibu saa hii, ama umeogopa kuuliza, utapata answers. Ndio. Usijikalie na ugonjwa nyumbani ukijiambia itaisha, itapita. Go get checked. Make it a habit. Hata kama unasikia tu ni kitu, enda upimo tu, angalia nini iko. Create, unajua vile amesema, tibiwa mapema. Usingoje kitu ikuwe ngori huko ndio inaanza kuwa balaa na inakulemea. Yeye ingetibiwa tu ikianza, si ndio? Amazingness. Tutapatana kesho hapa tukipika. Shataboy on Facebook, shata_boy Instagram, shata tikitaka Twitter, Steve Jacob Maunda, that is YouTube. Also follow Citizen at Citizen TV Kenya everywhere, and Willis Raburu same way. Tutapatana kesho. More life.